What's the name?
Christin Kamare, sir.
Okay, I call you Christin. Your age?
39,
Your height and your weight?
5'2", 6'5",
Your marital status?
single.
Single what? Single mother or what?
Single mother, ma'am.
How many
Yes,
children?
sir.
How many children you have?
I have like 3 children.
How old are they?
16, 14, 8.
Okay, who will look after your children when you come here?
My mother.
Have you got the permission from your mother?
Yes, sir.
Now, when you come here, are you already
Yes, ma'am.
are you mentally prepared to come here now? Are you already 100% mentally prepared?
Yes, sir.
Are you willing to sacrifice?
Yes, sir.
I mean sacrifice means when you come here, you must focus on your job. And don't come and tell me, my children give me problem, I want to go back, my mother, ask me go back, I have this problem, I have that problem, my boyfriend problem. I don't want all this. You come here, you concentrate on your work, you sacrifice, and make sure you finish your contract. Okay, after that, you want to extend, of course, you can do the extension. Okay, that is something between you and your mom. But at least when you come here, you must concentrate on your work. There's no such thing as you come here, you have problem over Philippines, then you tell mom, I want to go home, this and that. Can you assure me that or not? That you will come here and then you will concentrate on your job and you will sacrifice.
I can, I promise.
You promise me, sure, 100%.
Yes, sir.
What is your educational level?
High school level, sir.
How many years?
4 years.
Okay, I want to know your experiences. What are the experience you have?
I'm taking care for the bedridden, sir.
Can you tell me where all your experiences taking care of bedridden?
I'm taking me for bedridden in the Malaysia, 2 years.
Malaysia 2 years. And where else?
And then I take care here in the Baguio City for the colon cancer. 1 year is 8 months.
1 year and 8 months. That means 20 months lah. That means in Baguio you were looking after a patient. And
Yes.
Was the patient bedridden or still a semi-invalid or what? So what was your job in Baguio?
Bedridden, sir.
Okay, what was your job?
And take care.
I know
for
you
the-
take care. Okay, what was the job? Like for instance, you shower for her, you change the clothing.
Shower and I will be change my clothes and I will be bring there in the bed again.
Some
They
more?
will give me for the eating.
That means you feed her,
Yes.
you take to the washroom, shower her. Some more?
I will be carrying me. I will go to hospital
Okay, hospital for?
for the chemotherapy.
Oh, I see. So you send her, you accompany her to the hospital for the chemotherapy, am I right?
Yes, sir.
So that means this patient is a cancer patient now.
Yes, it's colon cancer.
And how old is she?
62 years old.
62. How heavy? What's her weight?
67.
So it's a she, and
Yes.
do you sleep with the patient?
Yes, sir.
I see. Okay.
This side. I
Ah,
will stay me there at the side.
okay. Then what about the food? Do you cook for the patient? Do you cook the food?
I cook for the porridge and anything for the Philippines product. Foods. Vegetable.
Okay. What about your experience in Malaysia?
Sir?
Your experience. You said that you also work in Malaysia. Your experience in Malaysia?
Yes, sir. 2 years.
2
I
years.
experienced in the Malaysia.
And what was your job?
I take care for the bedridden again, and then I will go to toilet. If I poo, I change, I shower, I put pampers, and then I will go to hospital for the dialysis.
And how heavy is this patient?
85 kg.
85. So that means you help her to get up from the bed, take her to the washroom, change the clothing. But 85 kg is very heavy. So you can manage. You can manage without any problem.
I can.
Are you strong?
Yes, sir, I am strong.
Okay. Can you stand up and put up your hand and I want to see whether you're strong. Okay. Okay. You look strong. So to lift out 85 kg patient is not easy. Okay. It's very heavy and you can do it without any problem.
No, I'm very happy
No, I mean
because I take care.
can you lift up the patient without any problem? Do you have anyone else to assist you, or you are doing it alone? To lift up the patient, you doing it alone?
Sir.
Huh?
I'm doing it. I can.
I know you do it alone, or you have somebody to help you to lift up the patient,
No, I'm give alone.
or you are doing it alone. Then you lift up
Yes.
from the bed, put her on the wheelchair or something like that.
Yes, I put a wheelchair, and then I will put me there in the bathroom. I shower.
I see, and I want you to remember these three alphabet. After that, I will ask you again.
CMB.
Huh?
CMB, sir.
No, it's MCB. Can you look properly?
MCB.
Okay, I want you to repeat for me 10 minutes time. You must remember. Okay,
Yes, sir. MCB.
so can you read and write?
Yes, sir.
Now, do you dispense medicine for the patient when you are in Baguio and in Malaysia? Do you do the dispensing the medicine?
Yes, sir.
So in Malaysia, do you help to dispense the medicine? That means give the medicine to the mom. They will tell you what time to give, what medicine. Do you think you can?
I can, sir. Morning and night.
But you have to make sure you give the right medicine.
Yes, sir.
And what were the medicine that you give while you are looking after the patient in Malaysia? Can you just name me the name of the medicine if you can remember?
I can give me Panadol and histamine for the allergy.
Has histamine because she is sleeping on one side, is it? Because
Yes.
Because of that she gets an allergy. Is it because of that?
Yes, sir. I can. She has allergy.
She has the allergy. And what about the one in Baguio? Can you just let me know of one name for the medicine?
Only Panadol, sir.
You mean you give only Panadol? Are you sure?
Yes, but
There must
Yes,
there must be some other medicine, or you forgot the name.
only, sir. I give as my boss. Only Panadol and histamine because evening, sir, is taking it now for the medicine.
I see. The one in Baguio, or what medicine do you give?
If not sleeping, I will give me for the sleeping pills. 3/4
Huh? What?
sleeping pills, sir, because she is not sleeping.
You mean there's no medicine for the sickness?
Yes,
Do you give any medicine for the sickness? Or
I give me for the antibiotics, sir.
antibiotic? You mean got no
Yeah.
other special medicine?
Yes, special medicine.
Huh? So these
Yes,
are
sir.
the only two medicine that you give. His Panadol and antihistamine. That one in Malaysia, and the one in Philippines you give what, antibiotic and what?
In the Philippines, if not sleeping, I will give me sleeping pills.
I see. Okay, so you must be able to remember when you're asked to give the medicine, what time, all this you must be able to remember. Can you?
Yes, sir.
Now, this employer in Malaysia is a babi, is a she. Okay, maybe she is 50 years old, maybe around 60 kg. She is a patient. She is semi-invalid. She needs your help. She is very feeble. That means she's very weak, and she also needs to go for chemo.
Yes.
Okay. So do you think you can do the job?
Yes, sir, I can.
Do you think you can lift her up and
Yes,
help her
sir,
on
I
the
can.
wheelchair, and take her to the washroom, and of course you will need to help her, maybe to take shower for her, change for her, pampers. Do you think you can do that?
Yes, sir, I can.
And she's maybe 60 over kg. Is it okay?
Yes, okay, sir.
And you have to sleep in the same room. Can you?
Yes, I can.
Okay. Uh, when the patient is sleeping or resting, you have to help into some housework. Can you do it?
Yes. Yes, sir, I can.
They got another maid there. She will be also doing the work, but sometimes you need to help her to do some housework because the girl is very small size. Okay,
Yes,
she
sir.
cannot lift up the patient, and you will have to do the job of looking after the patient. Can you?
Yes, sir, I can.
So you can sleep with the patient, you can dispense medicine, you can do like lifting her up, take her to the washroom, middle of the night, you will have to help her, give her the food, give her the drink. Do you think you can? Especially in the
I can, sir. I can.
middle of the night, you will have to get up. Can you?
I can, sir.
So you don't have enough sleep, then you maybe compensate your sleep in the daytime. But nighttime you will have to wake up to help her. Do you think you can?
Yes, sir.
Huh?
Yes, sir, I can.
So you will be like a caregiver.
Yes,
Okay,
sir.
you have to take care of her. And the main thing is you have to uh,
Yes.
take care of her, give her the needs, and give her the comfort. Can you?
Yeah, I can, sir, I can.
When I say the needs, that means when she need to have the drink in the middle of the night, or maybe when she needs the food like dinner, then you will have to help her, give her the food or give her the drink, and also change the pamper for her, lift her up from the bed, take her to the washroom. These are all the needs that she will need from you to help her. Can you?
I can, sir, I can.
Okay, when you say comfort, I want you to make her comfortable, talk to her nicely, have the love for her, and make sure you don't scold her. Is that okay?
Yes, sir, I can.
You need to talk to her patiently, and make her
Yes,
very. What means that you must be able to understand what she's telling you. Try and understand her. Be patient. You must be very patient because sometimes she might be a bit angry, even scold you. I mean that's okay, but you cannot scold her. Is that okay or not?
it's okay, sir.
You're sure?
It's okay.
So you are sure? Because when you come here, you have to sacrifice.
Yes,
Okay?
sir, I can sacrifice. Yes, sir, I can.
To look after a patient, I think you need a lot of sacrifice, and you yourself need a lot of patience. Am I right?
Yes, sir.
Because you have the experiences, you look after somebody in Baguio, whereby is a cancer patient, and also in Malaysia, I think that patient must be suffering from some kidney disease because they need to go dialysis. So you
Yeah.
have look after two patients before, and I'm sure you have got all the experiences. All in, you
Yes.
have worked for almost 4 years looking after invalid patient. Am I right?
Yes, sir, I can.
So if this patient were to employ you,
Yes, sir.
are you willing to do the job?
Yes, I'm willing, sir.
You are very sure?
Yes, sir, I'm sure.
Okay, then the house that you have to work in is not a big house. They got another maid there. The house is quite a small house, a normal house, maybe with 4 rooms, 3 baths. So you will need to help in the house. Is that okay?
Yes, sir, I can.
And the cooking, you might have to help the mom to give her food and maybe help in some cooking. Do you do any cooking while you are working in Malaysia?
I'm cooking only, sir, is adobo and porridge.
Adobo, that is in the Philippines.
Yes, sir.
Here also you cook adobo
Yes, sir.
and porridge.
Yes.
What porridge do you cook?
rice, sir. Plain rice, and I put the salted egg in fish.
Oh, I see. So you sometimes you cook fish porridge, sometimes you put salted egg porridge lah. So that means
Yes.
here you cook porridge for the patient lah. Am I right?
Yes.
You got any question to ask me?
No need, sir.
No need ah. Okay. Very important ah. You must take good care of the patient. Okay.
Yes.
Take good care. I mean take good care. Not just
Yes.
like when she asks, only you will just reply her. No you have to observe her, talk to her, make her feel comfortable. Have the love for her. Can you or not?
Can, sir. Can.
And when she needs you to help her, you must help her. When she needs the food, the drink, or whatever, you need to help her. Is that okay?
Yes, sir.
Huh?
I can. I can.
You can. Okay, now, if they want you to work on your off day, are you willing to work on your off day?
Yes, sir.
You have one off day in a week, and you work on your off day, you'll be paid. Okay?
Yes.
So, you are willing to work on your off day, but on your days that you're very tired, you're not allowed to go out. You stay in the house. Is that okay with
Yes.
you? Is that okay with you? You
It's
are
okay, sir.
you don't go out. Is that okay?
Yes, sir. It's okay.
Okay.
Let me go.
Now regarding the phone, you can call back to your family maybe once or twice a week, but don't call too often. Okay? And
Yes,
I
sir.
want to find out from you, can you sacrifice without a phone or not? Do you want to bring a phone?
No, sir.
So you are not bringing a phone,
Yes, sir. No.
Okay, you don't bring a phone, you want to call back, no problem. The sir,
Yes.
the sir will give you the phone, then you can call back. But
Yes, sir.
even if you have a phone, you must understand, you cannot use the phone during working hours. No phone during working hours. Can you accept that?
Yes, sir. I can.
Maybe in the night you can use it for maybe 20 or 25 minutes. That's all. But you don't bring a phone, that is very good. So you are sure you're not
Yes.
bringing a phone?
Yes, sir.
Now,
Cannot bring.
I am taping all this. I want you to remember what you are telling me. Okay, these are
Yes,
all
sir.
the things that you tell me. Or this only I'm bringing you for this patient to take care of her.
Yes.
Okay, everything you are telling me, you have to remember that you are willing to do the job. You are willing to sacrifice. You are mentally prepared. You will help the patient, to go to the washroom, to take shower, to feed her, to look after her needs, and also you are willing to work on off days, and you will not bring a phone. Am I right?
Okay, sir. I can.
Okay, can you assure me what you are telling me that you will
Yes.
do exactly? Now actually I'm interviewing you. I'm taping all this. Is that okay?
Yes, sir.
I think that's all lah. So I will get you the employer. Actually, you did well, but I want you to be mentally prepared. Is that okay?
Yes, sir.
Okay. What was the three alphabet I asked you just now?
MCB.
MCB. Yeah. Okay. Now, very important. You worked here in Malaysia before. Do you have any friends in Malaysia?
I'm experienced in the Malaysia. I take care for the bedridden, sir.
Yeah. Okay. But have you got any friends?
No friends, sir.
No. So you come here. I don't want you to make friends. You come here to work. Is that okay?
Yes, sir.
You
Yes, sir.
you focus on your job. You concentrate on your job.
Yes, sir.
Of course, you have enough food, you have enough sleep. You will take care of you, and also the salary. The salary is around maybe 20,500 at the moment. Is that okay with you?
Yes, sir. The salary is 1,680 RM.
Yes, that's correct. And if you work, you'll get 65 RM. Okay, on the off day. So if you work on your off day, you'll get almost 24 or 25,000 peso. So you just try and work as much as you can and get as much money as you can to help your children. You come here
Yes.
to work to help your children, am I right?
Yes, sir.
Okay, so there's no question, and
No need, sir.
I will give this video to the employer. If they take
Okay,
you,
sir.
then straight away, I will do the medical. Actually, you did well, so I hope you come here and then you will work properly lah. Is that okay?
Yes. Yes, sir.
So you are sure you can look after that patient which I described to you. Is
Yes.
is a mom, maybe around 50 years old. You need to help her because she is very weak and she needs to go to chemo.
Yes, sir.
Okay, so okay, that's all. Okay, thank you so much.
Okay, sir. Thank you so much.